do your patients come back? As a practice management consultant, I do what I call CPT analysis. And what that is basically I am looking at all procedures and office visits that a physician does in a 12-month period. And I have a certain algorithm that I run. And when I run that algorithm, I can tell very quickly if your patients are coming back. Now, why would you want your patients to come back? You know, most people are always wanting to market to get new patients in. That seems to be, the whole marketing campaign out there is to get patients in your door. The problem is once they get in their door, you see them once, but if they don't come back, you don't have recurring income coming in your practice. You're always trying to bring in new patients to fill those slots, when keeping your current patients is much better for the health of your practice and for the patient's health. So how do you get your patients to return, and why are they not returning to your office? Well, this is the first in a 3-part series that I'm going to talk about why your patients are not coming back to your office. Number 1, which is probably one of the biggest things that I see in practices that I go and visit, is that a doctor will say, "Mrs. Jones, come back as needed." Mrs. Jones has no idea what "come back as needed" means. Okay, does that mean that in 2 weeks when my foot's still hurting, am I supposed to come back? Does that mean when my plantar fasciitis starts up again, I'm supposed to come back? Does that mean that if I'm 90% better, am I supposed to come back? Patients have no idea when they're supposed to come back when a physician says come back as needed. We don't know what that means. And it actually means very different things to different physicians. So a physician needs to be very careful in their instructions to the patient. "Mrs. Jones, I need you to come back in 2 weeks. Mrs. Jones, I need you to come back in 3 months. Mrs. Jones, I need you to come back in a year." Okay? There should really be no reason for the vast majority of our patients that we should ever tell them to come back in as needed. For instance, our wound care patients. Well, if the ulcer has completely healed, what are the chances of them getting an ulcer in the future? Chances are you need to have those patients come in every 3 months for monitoring. Okay. What about the patient that you dispensed orthotics to? Chances are you need to check up on those orthotics in 2 weeks after you dispense them to make sure that they're still working and they're not causing problems. And then you need to schedule an appointment or a task to remind your staff to call them in a year and make sure that those orthotics are still working, especially in children. They can easily grow out of those in a year. And just for other people, maybe in a year they've loved their orthotics and they want another pair for their dress shoes. Or maybe, they're starting to break down a little bit. You need to be following up with these patients. Don't tell them to come back in as needed because they don't know when they're supposed to come back in. You are the physician. Tell them what is best for them. If for some reason a patient is 100% better and they don't feel that they need to see you, they're going to cancel that appointment. It is much better to err on the side of caution for the patient and for your practice to go ahead and schedule that patient. And if the patient decides that they're perfectly fine and they don't need to see you anymore, they will cancel that appointment. So don't tell your patients to come back in as needed. Tell them to schedule an appointment in a time frame, and they need to continue to see you.